If you see someone running, especially an ER nurse, you know that you need to figure out what's going on.
Oh, this baby was tiny. It was the smallest baby I'd ever seen.
This baby was terrifyingly small. Her whole body was blue and purple, motionless, looking as if she were dead. The doctor noticed the freshly cut umbilical cord still attached to her body. Clearly, it had only been a few short minutes since she was born. But surprisingly, her mother was nowhere to be found. Faced with the baby whose condition was worsening by the second, the doctor quickly realized this was an unprecedented life or death rescue. Dr. Khan had worked in the emergency department for many years and had seen all manner of strange situations. While on duty that day, a scream coming from the restroom caught his attention. A woman had seemingly witnessed something horrific and ran out of the restroom in terror. Following the woman's gesture, the on-duty nurse went in to check, but what she found left her stunned. There was a premature baby in the toilet bowl. There was no time to hesitate. The nurse hurried to pick up the baby and carry her into the examination room. Seeing this, the doctor immediately followed. After an examination, the baby's heart rate was only 60 beats per minute, far below the normal standard for a newborn. This meant her condition was extremely critical and she was at risk of death at any moment. Yet at this crucial juncture, the baby's mother had vanished without a trace. Before the doctor could figure out what was going on, the baby's condition took a sharp turn for the worse. The doctor suspected it might be related to her being found in the toilet. A toilet is a breeding ground for bacteria, and a newborn exposed to such an environment faced an extremely high risk of infection. To save the baby's life, the doctor had no choice but to administer CPR first. But to his disappointment, even after professional resuscitation efforts, the baby's breathing grew weaker and weaker. The doctor knew the top priority was to ensure the baby could breathe, so he decided to intubate her. He had someone fetch the professional intubation equipment, but soon enough, a new problem arose. Because the baby was so tiny, even the smallest tube was too big for her. What was more critical, her vocal cord area was nearly impossible to locate. Despite the overwhelming odds, the doctor kept trying repeatedly, just as everyone was on the verge of losing hope. Luck finally arrived. After the doctor lifted the laryngoscope slightly, in the next moment, the tube slid into the baby's trachea at last. Just as everyone thought they could breathe a sigh of relief, the doctor was faced with a new challenge. The baby's blood vessels were far too thin to inject any medication normally. Before the doctor could come up with a solution, the baby's heart rate changed again. The atmosphere in the examination room turned tense once more. After a difficult moment of consideration, the doctor had an idea. He injected the medication directly into the baby's lungs. Everyone was stunned by this risky move, but the doctor knew it was the only option they had right then. Fortunately, a few minutes later, the medication took effect successfully. The baby's heart rate returned to normal. As he watched the baby's condition stabilize, the doctor thought of something else: the whereabouts of the baby's mother. The doctor and the nurse reviewed the surveillance footage together. After numerous observations and comparisons, they finally spotted the figure of the baby's mother.